Thank you, everybody, for coming to Awaken Thriving podcast. Today, we have with us Dr. Alice. She is a doctorate of physical therapy from Marymount University. Welcome, Dr. Alice.
Hi, thank you so much for having me. It's nice to be here.
Yes, definitely. I wanted to chat with you a little bit. I know that you've done some somatic practitioner training and chronic stress. Could you tell us a little bit more about that? Chronic stress, I would love to know how to navigate that a little bit better sometimes.
Yes, I think it's such a hot topic because it's something we all relate to. I think everyone knows really what it's like to be under stress. And so I'm definitely happy to talk more about that. I love talking about this subject because I think, we were just talking about like the pelvic floor and core health and things like that. And I think the topic of chronic stress, while maybe it's more common in the vernacular, we don't really have a lot of education around how to actually deal with it or long-term how to approach and even understand it. But before I go into that, I'll just say, thank you for having me. And yes, I'm a doctor of physical therapy, and then the trauma healing work that I do and what's led me to a much deeper understanding of how chronic stress works in the body and in the nervous system is through my training with the Somatic Experiencing Trauma Institute. And so I'm in an additional 3-year program studying how to heal trauma, how to heal chronic stress through working with the autonomic nervous system and the physiology. And then, so I have 1 more year. I've just wrapped up my intermediate year of training. And then once I finish that, I'll be a full-fledged somatic experiencing practitioner, which is pretty exciting because it's wonderful work. I love it so much. So with stress, I think it's really important to understand, and I will try to keep this brief. I just did a whole hour-long webinar about it, so I could really go on, but I won't. But I think some of the key things to recognize are that stress isn't really innately bad, or it's not something we need to be afraid of. Our biological systems are designed in such a way that we're supposed to have stress responses to actual stressful situations. And the example I use a lot is like if you've seen the nature documentaries and you have the antelope running from the lion and they're running across the plains, and the antelope is in that fight or flight, right? He's got the high sympathetic nervous system activation, which is the system that drives the fight or flight responses. His eyes are dilated, his heart's pounding, he's running. But then what happens with animals in the wild that humans tend to bypass, and where we really get into trouble with chronic stress is let's say the lion gets distracted and then the antelope goes around, let's say he goes around a little corner by a little river in my fantasy world of this antelope situation. But the antelope, he lets his body kind of go through a discharge. And what that means is he'll take like a couple moments. A lot of times you'll see a little bit of trembling or shaking in the animal's body. And that's actually the stress hormones and the stress response within the nervous system kind of dissipating or discharging through the body. And then once that happens, the antelope is up and he's back to his antelope life. And he's not holding on to this stress response. And so we're designed the same way, where we're supposed to really go through these ebbs and flows within the nervous system of this high sympathetic activation when appropriate. If we're in a car accident, someone's chasing us, thank God we have a stress response, right? It saves our lives. But what happens more often than not is we'll start responding with this very high sympathetic charge or with this fight or flight response over being in traffic, or spilling the coffee, or we're late for a meeting, or we get in an argument with our partner. And then instead of allowing for the system to come down and do that little discharge, we just stay on a higher level. So it's like we're operating on this level where we constantly have our foot like jammed on the gas pedal, as an analogy, and we're just clinging to the wheel and racing through life at full speed with all of these sympathetic charges like remaining in our body and in our system. And so we never get a chance to allow for that discharge. Yeah. And then this becomes problematic on a number of levels: hormonal, physiological, biologically, mentally. We become drained, exhausted. Yeah. So yeah, it's a problem. It's a big problem, I think, in Western society.
How would we as humans discharge? What would we use, or what would we do?
It's really just taking time. Like if you're in a fender bender, say, and this actually happened to me last August. I was parked in a car and I got rear-ended pretty hard from behind with this guy just not paying attention. And so, you know, it's jarring. That kind of thing is jarring. And I'm like assessing, okay, I'm okay, okay. And then the next thing I did, because I'm studying this work, is I got out of the car and I sat down on the curb, and the guy's kind of all over and he's like, I'm shaky. I'm like, you're having a trauma response. Just sit down.
Yeah.
And so I just like sat on the curb for like 5 minutes, and I was like, I need 5 minutes. Like, I'm going to let my body process this. And there was a little bit of shaking, but it was more just letting my system kind of do what it needed to do to come down from that, instead of like maintaining that level of like high energy, like, oh my God, what happened? And then trying to go into dealing with the insurance and problem solving.
Yeah.
And we were in a safe enough place, a side street, where I didn't have to do any other immediate action.
Yeah.
So really, we can just take time. We can start noticing what's happening in our body as we're coming down. There's other techniques we can use. There's techniques like grounding and orienting. A lot of the work I do works with actually tracking what's happening in our own physiology and in our own nervous system. So those tools are really useful. It takes a little bit of practice to do that. But really, if you can just give yourself time, and I'm a big fan of like practice the pause, even if you're in an argument with somebody or someone's like demanding something of you, I think you can always say like, I need 5 minutes on that. I'll be back with you, and like walk away. Yeah. Let your body kind of go through what it needs to, and then revisit the situation when you've let some of that stress response settle.
Okay, that sounds good. And then can you tell me a little bit, like, what exactly is a somatic practitioner? Like, what do they do exactly? I know it's in the name, it's in the first name, but could you tell me a little bit more about that?
Sure. So the word somatic just means of the body. And so I do want to make a distinction that there are definitely a lot of different types of somatic therapies. And I know there's like somatic based yoga. So that's a little bit different than the training that I'm in, which is a specific like 3-year training just to work with trauma through the autonomic nervous system. So that training is called somatic experiencing. And it was work developed by Dr. Peter Levine. He's got quite a few books out on the topic. He's relatively well known in the fields of psychotherapy and particularly trauma healing.
Yeah.
And so it works kind of in the ways that I'm describing with stress. It works with the autonomic nervous system. So really the part of our nervous system that is more subconscious. Like autonomic just means more like automatic. So it's things that we're not necessarily aware of. It's like what's going on underneath the surface. And so what Dr. Levine developed and studied with this work, and he did a lot of work with, I mean, you can read his stuff to find out more, but from what I know, he studied like biomechanics. So he has a really interesting background. And then I think he's a body worker and a psychotherapist and has a doctorate in, I think, more than one thing. But it's fascinating work because what he discovered is that when we go through any kind of trauma, or chronic stress, what happens is that actually gets stored within the nervous system. And so let's say something happens to us, whether it's a big, traumatic event, or whether it's a series of small events, or whether it's something that we just perceive as traumatic. Like as a kid, I think that can happen quite frequently. Yeah. Maybe a dog lunges at us and we're like, oh, it's like really terrifying because we don't really have the wherewithal. Even as an adult, that can be pretty terrifying.
Yeah.
And
yeah, definitely.
And what can happen is that like our body's response will happen so quickly, and we'll have that high surge of a stress response, and it'll get like stuck in the body and stuck in the nervous system. So then, and how that presents is, let's say every time we see a dog, we cross the street, or we maybe we just don't like dogs at all, or we can't be around them. And so what can happen is that we'll start like closing off our life to avoid these situations that remind us of these traumatic things. And so somatic experiencing works with actually going in and having the person not so much relive the experience, but actually feel what's happening in their body around, like, you can tell a story of the experience, but it's really about like what's happening in the physiology. And there are definitely better explanations of somatic experiencing out there, but this is what's happening today as I'm explaining it.
I've met so many people that have had fears of dogs, and most of them have been from when they were a child, and they haven't had any really adverse experiences as an adult, but that's really making an imprint on them that they don't even want to be next to them at all. Even a little puppy, like they're terrified of puppies.
Yes. Isn't that interesting? And it's like one event will like set that in motion and it gets actually stuck, but you can work with that, which is what's really, really neat by working with the physiology. Like we could, I actually did this on an interview with, with somebody because she was like, I had a dog bite me. Let's do a little mini session. And so I asked her, I'll just use that as an example. I asked her like, oh, well, what are you noticing happening in your body right now as you're telling me about this dog? And she's like, oh, I noticed my foot's twitching. Oh, that's interesting. I'm like, okay, well,
Mm.
just notice it. Notice what's happening because your body has this trauma memory. And if we're able to work with it and slow it down and work with it in the present moment, because like within our physiology, some of the similar things of what we wanted to do or what we did, they'll start coming up. And so we can work with like helping to organize them, and helping them to actually like move through and then like it's not quite a discharge, but like move through and not be held in such a tight stored capacity. So
Yeah.
then maybe next time we see a dog, we're less afraid of the dog, or we're like, oh, that's different.
Yeah.
I hope that makes sense. I feel like I ramble a little bit. I really need to nail down a tight
Okay.
answer to a somatic experiencing. I interviewed my teacher, actually,
Oh,
Dr.
you
Abby
did?
Blakesley, on my podcast a while ago, and it did make me feel better. Her answer was by far more articulate than mine because she's been studying and practicing for so long, but it was still really long. So I was like, okay, sometimes it just takes a while to explain it.
Yeah, I think depending on what what you're talking about, sometimes like it requires a lot of words, right?
Mm-hmm.
In order to explain to people that aren't familiar with it. And then it takes a while to actually like cut it down to make it yours because that's your teacher's way that she presents
Right.
it, but then you need your way to present it. And I've done that so many times.
Exactly.
And yeah, it definitely changes with you. And let's see. And resiliency. I think we were talking about resiliency. What I know that's kind of like grit, resiliency. How do you teach that? I feel like people have to go through, unfortunately, trauma or adversity to actually get that. What do you think about that?
Right. And I think that's a huge misconception. And I was mentioning,
Mm.
I just gave a webinar on this topic. So if anybody would like to hear more about this in more of a concise manner, you can get in touch with me and I'm happy to share that recording for
Okay.
about the next few weeks. That'll be available. So it's kind of more of a clear presentation with some examples of some of these exercises. So I'm happy to share that with your audience if they like.
Definitely.
And so resilience is really the quality of a system, of any system, really, whether it's a person or an organization or a country or a community, to like bounce back from adversity. So when you look at it that way, it's like, okay, yes, maybe we need to go through adversity. But when we're really talking about building resiliency in the nervous system, which I want to say too, like if we're able to build resiliency in the nervous system, it means we're building resiliency up for chronic stress. We're building resiliency up for being able to respond better when stuff happens that's outside of our control, that is, stressful, damaging, harmful. Like we've got a better inner capacity to manage those things.
Mm.
So in this workshop, there are a couple tools that I taught that really just involve being present in your body, but in very specific ways. And so that's one way to build resiliency. And then because I work with the nervous system, most of the other ways that I have are kind of nervous system focused.
Okay.
Excuse me. And so if we're able to, I'm trying to articulate this better. If we're able to build, if we're able to expand our capacity to feel like ourselves within our nervous system, then we're less affected by external factors. And so we can do that by kind of clearing out some of these past trauma patterns or some of these past chronic stress patterns that have gotten stored in our body. So if we can help some of those to move out while simultaneously we're able to recognize more when we feel good, when we feel pleasant, when we feel like ourselves. It's like someone had a great analogy yesterday. It was like when you're tending a garden, yes, you can plant fruits and vegetables and you can plant more flowers, but you can also, pull out the weeds and make more room for more fruits and vegetables and flowers. And when we start to bring our attention to what feels pleasant, what feels good, what feels like us, and we train ourselves to do this over a period of time, then our system starts looking for that more. And it starts recognizing like, oh, I can go through life feeling like this, and I don't have to be under this constant stress. So both of those are ways to build resilience, to work with moving some of those patterns that aren't serving us out, but also to really focus on how does it feel when we feel good? How does it feel when we feel pleasant?
Yeah.
Because we tend to, as humans with this negative bias that our brains have, we tend to like skip over all the moments where we feel fine,
Yeah.
you know, or where we feel like kind of okay or pretty good. But we'll remember that one moment where someone like angered us or we had a conflict, like that moment sticks with us.
Yeah.
But
Definitely.
it's like with the pleasant moments, we have to really put our attention on noticing them and on relishing in them and allowing those to take up more space within us. And that's part of building resilience as well. And it's kind of a really fun part of building resilience.
Definitely. It sounds almost akin to just changing just the way you talk to yourself and the way you address stuff. Because I know that years and years and years ago, the way I spoke to myself in my brain, which we all do, it sounds a little crazy saying it out loud, but we all do.
Definitely.
It was not the most positive sometimes. And over time, learning new self talk actually changed a lot of stuff in my life. So I imagine learning different ways, as you were speaking about, changes your resiliency as well, that you can like make it through certain things a little bit more easier than you would like years before.
Definitely. Definitely. And I think that's a really good point too, is like, how are you talking to yourself? Um, and like, what is our conscious mind doing, and being able to really be more aware of that. And then also like twofold is what's happening in our body around it. Like, are we waking up and like, we're going through our day like this? Do we constantly have a racing heart rate? Are we super sweaty all the time because we're really highly stressed?
Yeah.
And can we start noticing times when we aren't like that?
Yeah, definitely.
And I
I
think,
definitely experienced a ton of that last year with my job. I was very high stress. And that's like a common, unfortunately, and I've said this before with other podcasts, stress and being like what you described is almost like a badge of honor. And that's what you do
yes,
when you work. That's what you do in corporate America. And I don't feel like it should be, but that is where we're at. If you're not at that level, then you're not working hard enough or
yeah. Isn't that crazy? I like, that's one of my missions, is to really crush that whole ideology.
yeah.
The idea of that. And it's huge. I mean, I'm in the entrepreneur world and the
Yeah.
entrepreneur community, and I've my mastermind groups, and I'm, you know, very active in all these things because I'm actively building my business.
Yeah.
But that when I hear that talk, I'm like, okay, wait a minute. Even the talk that we hear associated with business, someone on my LinkedIn commented the other day, they're like, oh, our second quarter goals, we smashed them. And I'm like, well, let's just take a look at the language you're using. Why do we use this kind of language of like, we smashed it, we crushed it, we killed it? It's like, what is that? What does that do for your system? And it's like subconsciously that throws you into at least a little bit of like a fight or flight response, because we're talking about smashing and killing and crushing. I was like, can we like just agree to adapt or to adopt a new vernacular around these things? Like, when I achieve my goals, I feel expansive, I feel tall, I feel elongated, I feel empowered. Like, that's what happens in my body. And I think we're talking about the same thing, but that language drives me crazy. I'm like, why can't we just have both, where we can take time to rest, recharge our batteries, and then come back and be really motivated and really enthused to do our jobs and to do our reach, and
Yeah.
you know, talk to all the people we need to talk to, and then when we need to, pull back, take some rest, go. I just spent a week in the forest, and that was great, and I came back so motivated. It's great.
You could recharge and everything.
Yeah, it was awesome. I did a backpacking trip, and I went to Tennessee for a week and just backpacked the section of the Appalachian Trail that goes through the Smoky Mountains. It was super great. It was really
How's the
cool.
weather over there right now?
It was nice. It was, I was supposed to backpack here in California, but it was so smoky. I last minute was like, all right, I'm going to go to Tennessee and do my
But
trip
you're like, I
there.
can't do it here, but I'm going to Tennessee. Why have you been in Tennessee before, or how did you know that there was going to be a good trail out there?
No, but the Appalachian Trail runs through the Smoky Mountains, and it's a well-traveled enough trail that I didn't feel weird about doing it alone. And there's like designated water spots. It's pretty like well laid out. Like, I think it'd be really hard to get lost on that trail.
Mm.
And I happened to have a map of the Smokies because I was going to backpack that section a couple years ago. So I was like, I think I could do it.
And
It
how are
was
they when it comes to COVID and everything over there?
it didn't seem super crazy at all. I stayed in a hotel like after I got out of the woods for a night, and we wore masks in the hotel. And on the actual Appalachian Trail, there's shelters where usually they want people to stay because they try to reduce the impact on the environment because a lot of people hike that trail. So they
Oh.
don't typically want you to put up tents, but there were signs at all the shelter sites that said, please sleep in your tent, like do, social distancing while you're out here in the backcountry.
Mm.
So yeah, that was kind of interesting.
And you reside in San Diego right now, right?
I do.
And so I'm in LA, Orange County, and
Okay.
I'm San Diego's a little bit more laid back. So have you been up to LA? What's the difference? I haven't been to San Diego since all of this started.
I haven't. One of my very best friends lives in LA. He's in West Hollywood, and
Yeah.
he was just complaining the other night about how everything's still closed. He was going on a date, and he's like, dating during COVID's like so stupid. And it sounds, I don't know if there's a big difference. I think we're maybe a tiny bit more liberal-ish with our policies here. I mean, I live in Ocean Beach, which is kind of a hippie beach town.
Mhm.
And here, I think there's a lot of like devil may care. Like I don't go to the beach, especially on the weekends, because there's just people everywhere. And
Yeah.
so I don't know if it's like that up there.
Well, I know that where I live, I have a place in Redondo Beach, and the
Mm-hmm.
beaches are just packed sometimes. Even they didn't
Yeah.
open them per se, but they didn't totally shut them down, and the police weren't ticketing anybody anymore. So once that kind of
Yeah.
got out, a lot of people are on the beach now for sure. So,
Yeah, definitely. I
but
don't
and how do
know. What
you?
do you do?
I know
I
we were
know.
talking about this a little bit, stress and COVID, because I know there's a correlation between because your immune system drops when you're in fear and you're scared, and a lot of people have been
Definitely.
in that state for a few months now.
Yeah, I know, since March.
Yeah.
Um, Yeah, and it's part of why I did this recent webinar about resilience building, because I feel like it's just important for people to have the knowledge and some tools to work with to help pull them out of that state. The SETI, the Somatic Experiencing Trauma Institute, has put out some really good YouTube videos about different ways to build resilience and practice stress, like stress management, I guess,
Mm.
throughout COVID. So I would definitely recommend checking some of those out. But
Okay.
one of the things that happens and that can happen is like with COVID, we're trying to locate the threat, right? And it's really it's a threat that we can't see,
Yeah.
and so that can actually lead to keeping people on high alert. Like in the situation with the dog, one of the first things we do is we try to orient to the threat. We try to find out where it is so that we can then plan our next move, get away from it, fight, flee, whatever we need to do. But with COVID, there's no place to actually pinpoint the threat. And so I think that part of it keeps people on even higher alert than they already would be because of all the disruption to everyone's lives. And one of the statistics I read is that if we don't integrate some of these like trauma healing and stress and resilience building practices, now we're going to see like much more PTSD like 6 months or a year from now. And that's definitely a concern of just people who've been in this really high stressful state for 6 or 8 months through
Yeah.
COVID without any tools. Like what are we going to look at then a year from now, like as far as our population and mental health? And
Yeah.
so I think it's really good. And this is something I've been talking about a lot recently too, is like, what can we do right now versus trying to wait till things go back to normal or thing. And I think we've all kind of realized that ship has sailed. Like we're not really ever going to go back to, normal. Things are just going to keep changing. But I
Yeah.
think if you've been trying, if anyone's been trying to sort of grit this out, like just stop and like learn some new tools now to start addressing stress a little bit differently and working with your system a little bit differently. Now's the
Yeah.
time.
And what is like, is there like one tool that you can leave us with that would be something that we could do, like grounding, or like
Sure.
what would you recommend? Just like one
Um,
tool.
yeah. Could I walk us through like a little 2-minute exercise? Do we have time?
Sure. Yes.
Okay. Okay. So, and you can, do this with me if you like. So whoever's listening, as long as you're not driving and you're in a safe kind of location where you can rest, I'll invite you to close your eyes. And just settle into your seat, or if you're laying down, you can settle into your bed or whatever surface you're on. And just notice your body being supported by the chair or by the bed. Notice it supporting your bottom, your back, and the back of your legs. And you can notice your feet on the floor. Notice if there's a weighted quality to your legs, to your pelvis, to your feet. And just be curious. And I'll invite you just to bring your awareness to the surface of your skin. And just notice if there's anything happening on the surface of your skin. And what I mean by that, is there a breeze? Is there any air movement from a fan? Or you can just be aware of the fabric of your clothes on your skin. And then bring your attention up to your nose and to your sense of smell. And you can notice what you smell in your environment, both in the foreground, things that are close, and maybe further away. Maybe there's a restaurant down the street and you pick up little tiny scents. Just noticing what's your environment through your sense of smell. And then you can bring your attention to what you're hearing and to your auditory sense. And just notice what you're hearing, again, both in the foreground, like my voice, and then what do you hear that's a little bit further away? Just noticing what's happening in your environment. And then in a moment, I'm going to ask you to open your eyes or invite you to open your eyes. But before you do, when you do open your eyes, I'm going to ask you to look around and let things come into your field of vision rather than trying to seek them out. So whenever you're ready, I invite you to go ahead and open your eyes and just let your eyes be drawn around your environment. Just let your eyes be drawn to whatever they're naturally drawn to. And imagine things just coming into your eyes versus trying to seek them out. You can notice if there's anything that's pleasant to linger on as you look around. And simultaneously, as you're orienting to your environment, you can again just touch base with your feet on the floor. Mm-hmm. Feel that sense of being in your body while being in your environment. And that's just a little bit of like a 5 senses practice with a little bit of grounding thrown in. Okay. It's really helpful when we're having like ruminating thoughts or being really stuck in something or really stressed out to sort of just drop into our senses. Yeah. And just take a couple minutes and notice like, okay, what do I feel on my skin? What's the taste? We didn't go through taste in that one, but what's the taste in my mouth? What do I smell? What do I hear? Yeah. And then the practice of visually orienting is really nice too. It helps to bring us back into like, oh, I'm here. I'm in my body. Okay. And okay, I like that. It was kind of a combination of like meditation and grounding a little bit, which was really amazing. I liked that a lot. Good. I'm glad. I like it too. It's really calming. And you were saying you have a program going on right now, right? Is it for resiliency? I do. It's going to start, I'm going to officially close the early bird registration October 1st. But it's a 3-month program and it's very individual based. And so I know this episode may not air before then. Mm-hmm. So if this is something that any of your listeners want more information on, I'll give you the link where there's a little application and then people can book a call with me to see if it's a good fit. Okay. And essentially, yeah, it's 3 months of one-to-one sessions where we do a weekly call via Zoom and work with your nervous system. Really, we do some of this somatic experiencing work. We work directly with whatever's happening for the individual to move through some of these things, to do just what we talked about, to unwind some of those patterns that aren't helpful and to build some of that internal resiliency. Okay. And 3 months is a great time period I've found. So that's why I'm just dedicating the rest of my year. I'm like, let's end this year feeling really good and really solid. Yeah, definitely. I feel like that's like, because the first 2 months were, kind of all right. But then the 3rd month hit this year and it'd be nice to have a lot of people end the year on a solid note. Yes, agreed. Okay. So is there any books right now that you're reading? I know you mentioned Dr. Levine's books. Any books that you're reading right now that you recommend to our listeners? Um, I just read like a novel when I was backpacking. That was pretty cool. It's called The Great Alone, and it was about homesteading. It was from the perspective of this 13-year-old girl homesteading with her parents, and her dad was a POW in Vietnam. So there was, it was really interesting. They moved to Alaska on a whim, and there was like some domestic violence stuff. But it's a well-written story. It was a
Okay.
really nice story for being in the woods. If people are looking for a good, engaging novel, I really enjoyed that one. The
Perfect.
Great Alone.
Great alone. Okay. And then
Yeah.
how about what is some of your favorite, let's see. Oh, this is a good one. What is,
I was
what's
really
the,
ready if you asked about food.
I
But
was
go
not,
ahead. Sorry.
what is the best compliment you've ever received?
Oh, that's so nice. That's such a nice question. I really like that. Um, I mean, I really feel like recently I just finished my intermediate year of this, my last course of my intermediate year for the SE training. And a lot of things I feel like came together for me as a practitioner. And one of the assistants who's like an established practitioner was like, you are really a skilled practitioner. And that meant a lot because I care about this work so much, obviously. And I've been really immersed in studying it for years and getting my own sessions and practicing. And that meant a lot. Yeah, that was really sweet.
All right. So that was one of that is a really nice compliment. Somebody that's um like an expert in the field, right? Telling you that
Mm-hmm.
you're a really good practitioner.
Yeah, that felt really nice. That and I liked like being on the trail. I had this one little 15-year-old kid who was like, and I'm walking up this hill and he's like, bro, you're just out here carrying all that stuff. That's pretty badass. And I was like, thanks, kid. It sure is.
Yes.
I was really tired at the moment. I was like, you got me up the next hill with that. Thank you.
Yes, we needed the encouragement.
Yeah, it helps.
So, one last question, and I kind of talked to you a little bit about this, but everything that we talked about, most of it is like really new to me. So, is there anything that I didn't say or didn't ask that I should have asked that you want to drop in?
No, I don't think so. I mean, hopefully that was at least a comprehensive kind of overview of this work. I feel like I can get a little tongue tied in talking about it because there are so many facets of it, but I think you did a great job.
Okay. All right. Well, perfect. So, thank you so much for being on my show. I appreciate it.
Yeah, thanks for having me. It was a pleasure.